Trauma and grief are two factors that contribute to poor mental health, and oftentimes those feelings aren't met with the right amount of medical attention early on. Children's Hospital of New Orleans has recently opened a center that caters to children dealing with trauma. Dr. Julie Kaplow is here to explain the services that it offers. Thank you so much for joining us.
Thank you for having me.
This center is so important, especially in our area where we have so many children exposed to trauma at such a young age. Tell us more about the center.
Sure. So the Trauma and Grief Center is really designed to help children ages 7 or above who've experienced any kind of trauma or the death of a loved one. We know that at least half of U.S. children will experience at least one trauma over the course of their lives. And we know that this is an especially important issue in New Orleans, where we are seeing such high rates of community violence and other types of traumas.
Sure. And you're saying that half of children will experience some kind of traumatic event. And I understand in most cases, they don't get the treatment they need to overcome that or move forward. So talk about what untreated trauma looks like in children.
Sure. So when trauma goes unaddressed for longer periods of time, we know that this can lead to a host of problem outcomes that can include longer-term depression, suicide risk, substance abuse, relationship issues, school problems. And in fact, we know that actually one of the strongest predictors of school problems is the death of a loved one. So that is one of the most potent traumas. And unfortunately, we are seeing high rates of bereavement in children across New Orleans due to both COVID as well as, again, community violence. So we're very attuned to the fact that the earlier that we can intervene, the better.
And so what happens when a child comes to you all for treatment? What does the treatment look like?
Sure. So we use evidence-based assessment to determine what the best course of treatment might look like for a child. So we know that actually the types of practices that are best suited for kids who have experienced trauma or PTSD look a little bit different than the best practices for grief or bereavement. So we want to make sure that we're using exactly what is going to help that particular child. And we look carefully at the needs and strengths of the child, their family, and what is going to be the best course of treatment. But we always use evidence-based treatments, meaning those are the treatments that have been backed up by research and are effective in reducing distress in children.
Yeah, as we've said, there's so many children in our area who could use this treatment. Is the center open to all children, and what are the costs?
Sure. So right now we are serving kids ages 8 and above in New Orleans. We also actually have a service through teletherapy where we can provide services to kids across the state of Louisiana right now. And currently the services are free of charge.
That is wonderful to know. I understand you guys also have a collaboration with Jefferson Parish Schools. Tell us a little bit about that.
Sure. So we have a great partnership with Jefferson Parish. We've been training their school-based clinicians to be able to provide the very same treatments that we do so that we can empower the school community to be able to address the high needs in that community of students who've experienced trauma and loss. So we're training them in our evidence-based treatments, and we also have helped them to develop some better screening procedures to be able to identify those kids that need the most help.
All right. Well, Dr. Kaplow, this sounds so important for children in our community. Thank you so much for joining us to tell us more about it.
Thank you so much.
All right, guys, you can learn more about the center at Children's Hospital online at chnola.org.